Hey, I'm Dr. McNabb, and you are most likely watching this video because you are interested in regenerative medicine therapies, stem cells, PRP. Maybe you've heard about it, but you're not really sure what it is or how it can help you. The whole goal of regenerative medicine and PRP and exosomes and those forms of stem cell therapies is to actually regenerate, rebuild, and repair the damaged cartilage. So it's more of a fixing what's causing the problem and less of just treating the symptoms. You know, far too often people get a knee injury or a back injury or some other form of joint like a shoulder injury, and they maybe tear a muscle or a ligament or a tendon, or maybe it's just a progressive thing over time like arthritis and degeneration. And up until about 15, maybe 20 years ago, there was really nothing else that could help people. It was mostly just treating the pain and the symptoms with painkillers and muscle relaxers, or sometimes cortisone shots or other steroids, maybe epidurals, and eventually, inevitably leading to some sort of surgery. You know, there's a lot of modalities that people also try, including massaging and stretching and ice and heat and chiropractic. And a lot of times, all of those modalities are designed to help to manage the symptoms. They're not really fixing what's actually causing the problem. So if you have significant degenerative arthritis of the spine or the hip or the knee, this video is for you. So most of the time, if you are in advanced stages of arthritis and degeneration, there's really not much else you can do. And while most doctors I know are focused on treating the symptoms with painkillers and muscle relaxers and cortisone shots, those therapies, those medications are designed to treat the symptoms, and you know very well, you've most likely had some of them already, or maybe you've heard of friends or family that have also had it, and it's always a temporary, chronic, always repetitive, just having to keep doing them over and over again. Maybe the cortisone shots will last for a week or maybe 6 months, or maybe they didn't work at all. And so if you've tried all of that stuff or you don't want to go down that road, we're going to explore different options. Another option for people with chronic knee pain or other small joint like wrist and ankles, they are the rooster shots or the chicken gel. It's basically like a WD-40 for your joints. Now, if you were in the earlier stages, like a stage 1 or stage 2 in terms of arthritis and degeneration, those types of therapies can work well. You know, lubricating the joints with gel or like a WD-40 type compound. Obviously, it's not WD-40, but that's kind of the equivalent of what that's like. That can work very well for you. You know, physical therapy, rehabilitating the joint, that's going to work well. But if you are in a stage 3 or a stage 4 of arthritis and degeneration, and you're nearing the bone-on-bone phenomenon, and a lot of doctors will tell you you're bone-on-bone, but you may not necessarily be there quite yet. But if you're nearing those stage 3, stage 4 scenarios, those gel shots, the cortisone shots, the painkillers, all those other therapies and modalities, they're just prolonging the inevitable. Maybe you've already been told that you're going to need a total knee replacement surgery. And if you'd like to avoid that, well, I'd like to help you avoid that too, because that's not a fun scenario. Nobody really wants to be out for 3, 4, 5 months. Obviously a lot of risk of infection, and a lot of things can go wrong. And unfortunately, about 40% of those people that have knee replacement surgeries are still in pain even after going through all of that type of procedures. So we want to help you avoid that. So when it comes to cortisone shots, the other problem that occurs is, although it helps to reduce the inflammation, it can actually further deteriorate the joint. It can cause further cartilage degeneration and cause more damage in the long run. So we'd like to also help you avoid those types of procedures as well, because cortisone shots, just in the long run, they'll temporarily help you, but in the long run, they're not going to do it. So my whole philosophy and focus is not just fixing and helping people treat the pain, but fixing what's actually causing the pain. And as I spoke about earlier, most of the problem is arthritis, degeneration, that bone-on-bone phenomenon that's actually happening. It's eating away at the cartilage and the meniscus. And even if you have a meniscus tear, several of my patients have previously had meniscus surgery to actually repair the meniscus, or in some scenarios, cut out the damaged meniscus. I just spoke with a lady earlier today that exact same thing happened. And so what we want to do is we actually want to repair the damage and heal and facilitate the damaged meniscus or the cartilage or the ACL, the MCL. And in a lot of scenarios, we can actually do that. So we're going to talk about regenerative medicine and what that actually looks like. You know, over the last 15, 20 years, there's been a whole lot of research and advancements in technology. Let's talk about what regenerative medicine is not. Regenerative medicine in stem cells is not using abortions or anything from aborted fetal cells or anything like that. That is illegal in the United States in several areas around the world. There may be some countries doing it. That's not what we're doing here at all. Regenerative medicine, the primary focus for using stem cell therapy, there's two primary methods. It's using your own body's stem cells, which are harvested from adipose tissue or a bone marrow aspiration. Those methods are the methods that were done a long time ago. Those were kind of the first methods of regenerative medicine therapies that were being done in the United States and over in Europe. And the problem with those therapies is when we're born, we have a lot of stem cells. Stem cells are basically what allow our body to grow from when we're first born from 8 pounds, 9 pounds, maybe 10 pounds, all the way up to when you're 18, 19, 20 years old to 200 pounds. The stem cells actually grow the cartilage, the bones, the tissue, and it's what allows us to go up all the way to 5 foot, 6 foot, sometimes even taller. And as we age though, once we hit 18, 19, 20, 21 years old, our stem cells start to decline. And so when we're first born, we have one stem cell per 10,000 cells. So there's a lot of potency and quantity to those stem cells. And by the time we are 50 years old, we have one stem cell per 400,000 cells. And by the time we're 80 years old, we have one stem cell per 2 million cells. So they dramatically decline as we age. And so our stem cells, your own stem cells, not only do they have fewer quantities, if you're 50 years old, you only have one per 400,000 or possibly less, but they've also been with you your entire life and they've been exposed to everything that you've been exposed to. Nicotine, alcohol, other medications, environmental toxins. And so your stem cells are not necessarily the best quality stem cells. And so we don't like to use adult stem cells. What we use are called mesenchymal or umbilical cord derived stem cells. Those stem cells are harvested from the umbilical cord. And so after the birth of a live, healthy baby, if the mom doesn't want to keep the umbilical cord, which is becoming very popular these days, she is asked if she wants to donate that umbilical cord for medical and research use. And so after the umbilical cord is actually cut, that section of the umbilical cord is then tested for any sort of infectious disease or impurities. It goes through about a 4-step process. The cord is tied, it's tested, and the stem cells are actually extracted from the cord blood. The platelets and plasma and everything is separated, and then it is cryogenically frozen. So there are millions of stem cells in that umbilical cord, possibly billions or trillions in a section of an umbilical cord. And then the tissue bank, which the ones that we use are all FDA approved and tested. They're all tested for any sort of infectious disease or DNA abnormalities. They are cryogenically frozen, and then we purchase the stem cell directly from the lab. And so if you're looking into doing stem cells, In our opinion, we've been doing this for a while, our medical team, we believe that this is the best form of stem cells. It's the most potent because in 1 cc of fluid, or what's shipped to us, you can measure 1 million to 1.5 million stem cells per 1 cc. So the quantity of stem cells is far superior to anything that you can possibly get from your own body, unless you take out a whole lot of adipose tissue or bone marrow, which a bone marrow aspiration is very painful, of course. That's a major procedure. You may risk infection. But anyways, getting back to umbilical cord-derived mesenchymal stem cells, that's what we are using. And that is a very, very powerful form of regenerative medicine. It has the ability to repair, to regenerate, and rejuvenate that damaged cartilage and the meniscus, and also surrounding ligaments and tissues like around the spine or around the hip joint, like a labrum. We see oftentimes the stem cell therapy can regenerate damage and repair damaged meniscus and ACLs, MCL, PCL. And so we're using it for the more advanced degeneration and arthritis. And so it is really a way to repair the actual cause of the damage instead of just treating the symptoms. Other forms of regenerative medicine, maybe you've heard of PRP, or platelet-rich plasma. This process is taking out some of your own blood, spinning it in a centrifuge that separates the red blood cells from the platelets in the plasma. That plasma is then taken out up through a needle in a syringe and then directly injected into the joint. Now, oftentimes, if you are in the earlier stages, stage 1, stage 2, arthritis degeneration, or the damage isn't that bad, if it's a more mild scenario, or possibly if it's a smaller joint like a wrist, an elbow, or an ankle joint, we can use PRP to inject directly into the joint, and that will also help to heal and repair. Oftentimes, if it's a larger joint, like a spinal joint, a hip joint, or a knee joint, we are using PRP in addition to the stem cell therapy to help with the rejuvenation process. If you're in the later stages, like stage 3 or stage 4, the PRP alone just isn't enough to actually repair the damage. And so we don't want to just prolong the inevitable knee replacement. We want to actually help you to avoid that. And so those are the methods that we're using here in our office, and we've gotten really phenomenal results. The most common joints that we treat are knees, hips, and spine. We've also helped quite a few people with plantar fasciitis and tennis elbow and golfer's elbow, shoulder issues. I myself had a shoulder issue, and we did stem cells and PRP in my shoulders, and that was absolutely amazing. I've had chronic shoulder pain myself for over 15 years, and the results that I'm seeing after just 5 going on 6 weeks at the time of shooting this video are absolutely amazing. I have full range of motion, no pain anymore, and I'm still using it. I'm back in the gym, and several of our patients are experiencing very, very similar results. Another common question that we get all the time is, how long does this last? You know, you may be used to going through a series of cortisone shots, or if you've had another doctor tell you about the rooster shots or the gel shots, that's typically a series of 3 to 6 injections. With stem cell therapy and PRP and all forms of regenerative medicine, the goal is for you not to have to repeat this. Now, for some people, for the more severe scenarios, stage 4, and even if you are bone on bone, there is a likelihood, a strong likelihood that we can still help you. We are just more aggressive in our approach. So we are using a lot of stem cells, a lot of PRP, and for most people, 1, maybe 2 rounds of injections are all that's needed. And the goal is for you not to have to repeat this again in another 6 months or in another year or not even 10 years. We've been doing this for going on 3 years now, and most of my colleagues that have been in this for 7, 8, 9, 10 years, they have yet to see people back for further injections. You know, the goal is actually to regenerate and repair and regrow the cartilage. Those stem cells that we use, they can repair and continue to replicate and divide and repair the area for up to 4 to 9 months later. And so as you'll see in this before and after, we can take an x-ray after we do the procedure, usually several months, 4 months, 5 months. The example of this one here was 6 months later. As you can see with the knee joints, now this individual had a partial knee replacement surgery already, and the damage on the right side of the knee, the right knee, was even worse, and it was bone on bone. And so as you can see in the before, the 11/20/18, the pre-stem cell picture that you see those x-rays, you'll see the inside of the right knee is very near to be bone on bone. So we used stem cell therapy for this individual, and just over a year later, on January 21st, 2020, we retook the x-ray, and you can see the regrowth in the new space that it created from just doing the stem cell therapy along with PRP. And so using that stem cell, those forms of regenerative medicine, we were able to help him avoid another knee replacement or more surgery, because his doctor wanted to do a full knee replacement on his right knee. So those are the kinds of results that we're getting. And here's another one. So this is Mara. She was only 42. She had an injury from playing soccer a long time ago. And over the years, it had just been a chronic, reoccurring injury. She would injure it. She would go through some cortisone shots, have some physical therapy. She tried other forms of steroids and muscle relaxers and a lot of NSAIDs. She would go through a lot of Tylenol and Advil and Motrin, basically whatever she can get her hands on. And she was really struggling. And we did stem cell therapy and PRP in her hip joint. And in just 6 months, she was dancing at her best friend's wedding, where before she wasn't even able to walk from her car into the grocery store without pain. 6 months, she was able to be dancing at her best friend's wedding. So just amazing, amazing testimonials. I love seeing this stuff. I have one more for you. Here's Nick. He was 71 years old. This is his spine. And you can see in February of 2020, we did an MRI that showed he had severe spinal stenosis. It was causing a lot of pain in the back, shooting pain all the way down both legs, and he could barely walk from his car inside of his house, and he had a garage, so that was just debilitating. Just to give you some insight on how far and how bad the pain was, he was basically laid up in his house and bedridden. He had tried a lot of different forms of cortisone and steroids and painkillers and muscle relaxers, and he was getting addicted to opioids. And so over the course of time here, what we did is we took some stem cells, we did more x-rays, more imaging, and we used ultrasound guidance to do regenerative medicine therapies using stem cells. We used 2 milliliters of stem cells. We also used exosomes, which is another form of regenerative medicine. And we did 3 rounds of PRP and a decompression brace. So his protocol was a little bit more aggressive, but it was aggressive because of the severe spinal stenosis. His surgeons wanted to do a fusion surgery on L3, L4, and L5 to stabilize, and he did not want to go through with that major back surgery. So we did the stem cell therapy, and as you can see in the after, which was in August of 2019, so from February to August, just 6 months, that was his follow-up MRI, a complete resolution of the spinal stenosis. It repaired the damage in the disc. We also did some exercises and some physical therapy, rehabilitation type stuff afterwards, in a complete resolution. He is no pain, completely back to golfing and exercising and playing pickleball, and he loves playing pickleball with the grandkids, and that was kind of his big why and motivating factor. So
I had bad arthritis pain. The pain creams and the pills stopped working a long time ago. Couldn't even walk to the bathroom some days because the pain was just so excruciating.
I had pain in both my knees, and I was told a long time ago that I would need knee replacement surgery. The pain got so bad I had trouble walking through the grocery store.
When I was younger, I played a lot of sports and I got torn meniscus in my knee, torn ACL. It was repaired. Fast forward now 20 years and the pain's back. I started doing research on stem cells.
I heard about stem cells.
I was skeptical about the stem cell.
Came up with Dr. McNabb and his team.
A friend had it done in Boca, so I decided to check it out.
I met with Dr. McNabb in September 2020 and I decided to give it a shot. And boy, am I glad I did.
Down that road we went with stem cell therapy, and now here I am. It's 10 months, no more pain. I can play tennis again. I can play with my kids again without having issues in my knees.
They did the stem cell injection in December, and by February my pain went from a 10 out of 10 down to a 2.
And I felt better within a couple of weeks. I'm now 4 months out and I can walk around the whole store. And I'm even back to playing pickleball twice a week.
Thank you, Dr. McNabb.
Thank you, Florida Regenerative Health Centers.
He'll help you. So thank you, Dr. McNabb. This video is made for you.
Hey, so if you're just sick and tired of dealing with this pain and sick of treating the symptoms and prolonging the pain and the agony, if you want to get back to you and living your life and doing everything that you want to do, please give us a call, click the link here, schedule an appointment, just come meet with me. We'll do an exam, a consultation, we'll take some x-rays. If we have to send you for an MRI, we will, or we'll review your previous imaging that you've already had done. We will see and come up with a protocol and a plan to help you. I'm sure that we can help, even if other doctors have told you, no, we can't help you, you have to have a surgery. If you don't want to have a surgery and you're trying to avoid that and you want to get back to living life, give us a call. Click the link below. I really hope to see you soon.